probably will not be as rejuvenating as his joke was. Tonight I want to give you some information about the prescription drug market and how marketing by drug manufacturers or pharmaceutical companies influence and impact our overall healthcare costs today. Furthermore, I'm going to give you some examples of drug classes whereby if you're taking some drugs in those drug classes, there may be some alternatives that will be cheaper for you and for your insurance plan. Let's start talking about drug marketing. Drug manufacturers market to consumers and to prescribers. And prescribers are physicians and other healthcare practitioners that write prescriptions. For the consumers, we've all seen the TV advertisements. We've seen commercials about Advair, we've seen commercials about Lunesta, Nexium is a very popular drug. We've seen Sally Fields promote Boniva. And 10 years ago, there was no direct-to-consumer marketing on TV. So most patients didn't know the names of the drugs unless they were actually taking those drugs themselves. Today is a little different. A patient may walk in a doctor's office today and say, you know, I've been having problems sleeping lately, and I was watching TV last week and I saw this commercial for Lunesta, and they say, Lunesta is a good drug to help you with sleep problems. I think Lunesta would be a good drug for me. So, will you write a prescription for me for Lunesta? The doctor wants to make the patient happy, has no evidence that Lunesta is not a good drug, so they write a prescription for Lunesta. Lunesta is a $200 drug. Now, drug manufacturers also provide financial incentives to patients. Let's say that Lunesta is $200 and the patient has a copay of $50. So they pay $50 and the health plan pays the other $150. Well, if the drug manufacturers provided a coupon for $50, then they've kind of wiped out the patient's expense, right? Well, there's still the balance of $150 that the health plans pay. So what happens in that situation? Later down the road, who's going to be paying for that $150? The consumer, in the form of increased healthcare premiums. Right? The other thing they do is they market directly to the prescribers, the people that are writing the prescriptions. They will visit the doctor's office, they will bring lunch, they will bring donuts, they will bring pens that have nice logos on them, notepads. They will also explain why their drug is the best drug for certain medical conditions. They will provide samples for the doctor to hand out. And these drugs are good drugs. In most cases, the drugs are very effective in treating those medical conditions. But the question is, are these new drugs that are being heavily marketed, are they any better than the drugs that have been on the market for 10 years, 7 years, and are off of patent now, and they're now available generically? In many cases, no, they're not. I'll start with an example with Nexium. And Nexium's in a drug class called proton pump inhibitors. Proton pump inhibitors are used to treat gastric acid reflux. So if you have heartburn or stomach ulcer or burning sensation in your esophagus, you're likely going to be prescribed proton pump inhibitor. Nexium is probably the most popular drug in that category, but there are many other drugs. There are other brand drugs. There's Acifex, there's Protonix, there's Dexilant. All those are brand name drugs and they're pretty expensive. Nexium costs $180 for a month's supply. There are also over-the-counter products and generics available in that drug class. Prilosec was a very popular drug many years ago until it lost its patent and went generic. The generic of Prilosec is called omeprazole. The manufacturer for Prilosec, AstraZeneca, knew their patent was expiring. They were making a lot of money off of that drug. And so they said, well, what can we do to continue this stream of revenue? And so what they did is they went back to the lab and did a different formulation of Prilosec exactly the same. All the research studies that have compared Prilosec and Nexium, or omeprazole, have shown that Nexium is no more effective than omeprazole or the brand Prilosec. But the difference in cost, Nexium costs $180. Omeprazole and over-the-counter products like Prilosec OTC, Zagrid, and Prevacid 24-hour all cost about $20. So if you have a health plan where your copay for a generic is $10, $10 cost to you for Prevacid 24-hour or omeprazole, or $50 brand copay for Nexium. The plan also saves if you switch to omeprazole. The plan's only going to pay $10 because $20 total cost, and then the plan's going to pay $150 for Nexium. Now another example is in sleep aid drugs. We talked briefly about Lunesta earlier. Same thing, $200 for Lunesta. Patient pays probably $50 for that. Plan's going to pay $150. Well, Ambien, another very popular drug years ago, has been available generically for a while now. It costs less than $2 for 30 days of blood. So, in that case, if it's a $10 copay for the plan on generics, but the drug's less than $10, the patient's only going to pay the $2. So $2 versus $50 for the patient. But most patients don't know these things. They need to be educated on these different products and alternatives. But the point is, marketing by the drug manufacturers has been very, very effective in the last 10 years. They spend lots of dollars on that, and they have done great with their marketing. But it is also costing our healthcare system a lot of money. There are many other drugs similar in other drug classes. So if you're taking a drug